just pay attention to those four things. Take them off from work, missed appointments, modify work. If they can't for whatever reason, it's usually money, transportation, or time, work. Treatment at the end. Let them know that that'll hurt their, let them know, not just clinically. Clinically now, you're just doing palliative therapy. But how it'll hurt their injury ward. And then make sure that if the first time they miss, you set them down, but you should have let them know that before they missed. And then as soon as they miss that first time, you better deliver the potential permanent findings based on the science of the three phases of healing without physical medicine. And then also let them know the injury ward, and you better pick up that phone and call that attorney the first time they miss. He'll appreciate that. Matter of fact, that's one of the service factors. That's one of the 8 service factors that will call you if the patient missed. Because remember, that's hurting their pocket. That patient misses, that's hurting that attorney's pocket. You're not bothering them. That's called good service, is what that's called. So anyway, that question kind of led to these other 4 major issues. So yeah, those 4 major issues are real important. I see doctors not doing that. They don't take them off. They don't document why they couldn't or come in. They don't do modified work. They don't control them with missed appointments. And then they don't get them to come in for care at the end of care. I mean, you just set yourself up. You just set yourself. How's this look in front of for an insurance adjuster or a trial jury? You just set yourself up to lose. I mean, it's hard to recover from that. That's hard to recover from. You know, that shows a lot about the patient's intention and the legitimacy of what you're doing, all that stuff. And by the way, if they do anything else, it needs to be documented. The dates and the services and the amount. Like say they go and get massage or they go get medicine from a GP or whatever. All that stuff supports the case. It helps and supports the case. By the way, same with over the counter, home, anything after, I'm talking about after MMI, anything they do with home care, anything they do with over the counter medication, you need to just make sure you document that. Yeah, they take ibuprofen, you know, every other day, 400 milligrams or whatever. Or they limit this or that. In other words, you want to show that there's stuff going on here. The worst thing you could do is go to MMI, then not get care, you not document anything, you not document, you know, home care, prescription care, over-the-counter care, supplement care. In other words, there's nothing. So it's like they're at MMI and then they didn't do anything. That looks bad. That looks real bad.